This video is important not only for the elderly but also for the youngsters. It is important for the elderly because they are practically experiencing the pain and the symptoms from their shoulder, but also the young people might be caretakers or they might be looking after their parents or grandparents who are experiencing shoulder pain. So basically it's the same story. Lots of my patients, elderly patients particularly, come to me in my clinic saying that they have, number one, pain in their shoulders. Number two, they might also have some stiffness of their shoulders. So the job for me is to dig out why this is happening. There are potentially three reasons why the elderly experience pain and stiffness of their shoulder. The first important condition is arthritis of the shoulder. If it is arthritis, it is easily detectable by a clinical examination and a simple X-ray. I'll be able to tell you whether we can carry on with this or it needs a shoulder replacement. If the symptoms are bad, a shoulder replacement is definitely going to help. We can reduce the pain, we can increase the mobility, and the patients don't have to undergo through suffering for a long time. The second important condition is frozen shoulder. This is completely different from arthritis. There is stiffness of the soft tissues of the shoulder, but it presents in the same way. There is pain and stiffness of the shoulder, but the treatment differs. It is quite easy. You have to control your sugars if you're diabetic, and you need physiotherapy, maybe a shot of steroid inside your shoulder, and you're set. This will make sure that your shoulder behaves itself. The pain is gone, the mobility is restored, at least a few months or years, if not permanently. The third important condition I want to talk about is rotator cuff tears. It's a slightly complex condition. We can try conservative treatment for this. That means we can try physiotherapy, maybe some painkillers, maybe a shot of steroid, but sometimes it needs surgery also. The rotator cuff, if it is torn, it needs to be repaired and it needs to be set back into its place. If this goes on successfully, then you're back to normal life and you're set for life.